The 17th century in Europe. The 17th century in Europe was a period of significant scientific and medical advancement. It saw the emergence of influential figures in the field of science and medicine, including Galileo, Kepler, Bacon, Pascal, Descartes, and Newton. These natural philosophers, as they were called at the time, brought about profound changes in culture and human understanding. Key developments and discoveries from this era include scientific discoveries. The 17th century is often considered the age of great discovery in science. Scientists of this era laid the foundation for modern scientific thought. The concept that the universe operates like the clockwork mechanism became prominent, and the idea that the human body is also a machine gained recognition. William Harvey's groundbreaking work revealed that the human heart functions as a pump, circulating blood through the body. Paracelsus introduced the idea that the human body is influenced by chemical reactions, which can be affected by plants and minerals. Ambrose Parry advocated for the tying of blood vessels during amputation to prevent excessive bleeding. The use of arithmetic on paper led to the invention of decimals and calculus, contributing to the development of mathematics. Medical practice. Medical practice in the 17th century was evolving with significant contribution from various fields, including physicians, surgeons, and dentists. The physicians. William Harvey's work on blood circulation was highly controversial at the time, but later gained acceptance. Thomas Sydenham emphasized the importance of closely observing patients and their symptoms, earning him the nickname, the nickname English hypocrites. Microscopy, which emerged at the end of the 16th century, enabled the study of cells and microorganisms. Anthony van Leeuwenhoek in 1683 observed individual red blood cells and identified bacteria under the microscope. The surgical practice in the 17th century was still relatively good and often performed without anesthesia. Surgeons were known as barber surgeons, and hygiene standards were lacking. Procedures such as amputations were performed, and bloodletting was common to treat various ailments. Skull trepanning, the drilling of holes through the skull, was practiced to address certain medical conditions. Marie Collinet improved techniques for cesarean sections and used magnets to remove metal fragments from patients' eyes. Traveling lithotomists toured the country to remove bladder stones through incisions in the perineum without anesthesia, with high risk and complications. The dentist. Pierre Foucault, often called the father of modern dentistry, was a French surgeon known for his contribution to dentistry. Despite limited surgical instruments of the time, Foucault made innovation in dental instruments, sometimes adapting tools from other professions. He introduced dental fillings as a treatment for dental cavities and theorized that sugar-derived acids were responsible for tooth decay. Foucault also suggested that tumors could develop in gums during the later stages of tooth decay. To summarize, the 17th century was a period of profound change in the field of science and medicine in Europe, with significant advancement in understanding the human body and the natural world. Despite the limited knowledge and technology of the time, these discoveries laid the groundwork for the further development of science and medicine in the following centuries. And that's all. Thank you.